Hey everyone, for TRICHOMES.com, I'm Ashley Manning, and this is Careers in Cannabis. On this show, we sit down with staffing agencies, cannabis companies, and other industry professionals to discuss employment opportunities in the burgeoning cannabis industry. Today's guest held a pioneering role as the nation's first cannabis and hemp specialist for the Denver Department of Environmental Health. As their public health investigator, she conducted facility inspections in all cannabis verticals and wrote tickets when orders were not followed. Some folks even gave her the nickname the Weed Whacker. On this episode, we follow the journey of former regulator and now founder and CEO of Allay Consulting, Kim Stuck, whose company mission is saving cannabis companies millions through their preventative measures. Allay Consulting is using their regulator knowledge and skills to assist the cannabis industry in producing safe, consistent, and compliant products. Hey, Kim, welcome to the show.
Hey, how's it going?
It's great to have you here today. I've been looking forward to this interview for a little bit since having the opportunity to connect with your PR team. I think that it's important that the industry as well as consumers understand what they hear the word consultant a lot in consulting firms. And I think it's broadly used, but you have in my opinion, the skill sets and the knowledge to be the consultant that we need in the industry overall. And you've brought a lot of those skills into the cannabis industry. So I'd love to just start with your career in cannabis before it was actually a career in cannabis. What were you doing right before, maybe right out of high school, college, wherever you want to start?
Yeah. So I worked in the restaurant industry for a very, very long time. And then when I started going to college, I went for a human nutrition biochem, which is kind of a really geeky, there's a lot of food safety, a lot of anatomy, a lot of culinary classes. Like it was a weird mix. Mm-hmm. But during that time, I made really good friends with my food safety professor because I was kind of a nerd and really liked the food safety side of things. And he went, hey, you should get a job as like a health inspector. You know restaurants really well. And so that's how I kind of got into working for the government. So I applied to be a health inspector in Denver, Colorado, which is where I started my food safety career. So I was doing wholesale food and restaurant inspections. So I know a lot of restaurants in Denver, if anybody ever wants to know. And it's, that's kind of where I got my government start. And then in 2014, they made cannabis recreationally legal in Colorado. And so previously, in the medical side of it was really unregulated, completely. In fact, you could go buy edibles and you didn't even know how many grams of THC were in them at that point. Like you were just like rolling the dice on those brownies. And so, it was really interesting. It was kind of a strange new world for me. I was so used to that food side. And on the food side, people are they've been in it their whole lives a lot of times. And so they're kind of educated on food safety and things like that. But for the cannabis side, people were getting involved and really had no idea what to do when it came to food safety and things like that. So 90% of what I did was, on top of all the recalls and fun stuff like that, I was educating. And so that's kind of how I started. I did that for a little over 3 years. And then in 2017, I decided to start my own company, just doing exactly what I was doing, just for the industry instead of as a regulator. And so we cover, FDA regulations, which is what our regulations in Denver were based on. FDA, OSHA, fire code. We do GMP certification and ISO certification, and then also organic certification on the hemp side. So we do a lot of that fun, QMS stuff, quality assurance, and making sure that you can manage what you're doing in your production facilities and in your cultivations.
Wow. That's a lot.
Yeah, sorry.
So you're good. No, it's a lot. I want to back up to when you were on the regulatory side of things. What were you like? What was your biggest challenge that you wanted? Because I'm sure, just based off what I've learned from you, you wanted to change those regulations, not change them, but help implement them in cannabis businesses. But you're on the regulatory side; you're there to enforce them. Is that where you got a knack for wanting to kind of go onto the other side and help these businesses? Is that what I'm gathering?
Yeah. So I mean, I obviously was kind of, you have to do this, right? Mm-hmm. Everybody, all of the regulators, I think there was like 8 of us at the time, 7 or 8 of us at the time, all of us were tasked with cannabis on top of all of our other restaurant stuff, right?
Oh,
So
wow.
after a while, they realized that, holy cow, that we have a lot of licenses. There's over like 1,000, I don't even know. I think it's over 2,000 licenses in Denver now. But at the time, it got over 1,000 and we were like, holy cow, this is way more work than we thought it was going to be, because exactly as you said, as I said earlier, people didn't really know what was going on. They weren't used to being regulated. They had never seen a health inspector before. And so it was just a really, those inspections would take a whole lot longer because we had to explain things really well and understand that we understood the processes, because once again, I didn't even know what extraction was at that time. Like, I thought we were just legalizing a plant, and we legalized a whole lot of other things instead of just a plant. So yeah, I fell in love with the industry is really what happened. When you're a regulator, you're really limited to what you can and can't say. You're not allowed to give any advice. You can't give them options. You can't, nothing. It's like, this is the regulation. You have to become compliant with it. And they go, well, how do I do that? And I said, well, that's up to you. And that's all I would really say. And as a consultant, we that's our job. We give them, hey, these are your options. This is what they're talking about. This is really what they want to see. And, having that perspective and understanding how to read regulations really well, and then have to be able to break down those regulations and explain it to people and have them understand it, because we train all of our compliance officers and things like that in our facilities as well. Yeah. It's a really intense skill set. A lot of people might be able to read regulations and kind of understand them, but being able to teach those to people is really, I think, where our strength came in. And we were taught that by, government bodies. So, it's really a trip. It's kind of a hard job sometimes, but we're really, really good at it. And we love the people that we work for. And we work as hard as we can to make sure that they can, produce whatever they're producing and not get shut down. Yeah.
My next question to you was regarding skill sets. Did you have to obtain, in order to work specifically with cannabis clients, how did you have to get new skill sets for them? But it sounds like they gave that to you. And were there those skill sets? Were they skill sets that they got from other industries, from food and beverage industries, that they're just parlaying into cannabis? Or were they a little bit more in detail? Or are you not allowed to tell?
Well, so, we had to learn a lot about conflict mitigation and, dealing with angry people all the time. When you're a regulator, you have to really keep your cool and be super professional at all times. Because people, if you do something wrong, they'll sue you for sure. And it's, a lot of weird situations. So I learned a whole lot about that. Honestly, I think most of the people skills of like running a business, I don't think I got from being a regulator. I got from being a bartender, believe it or not. But, you do have to learn a lot of, how to deal with issues and how to deal with it was a whole new level of them not understanding what was going on. And not understanding how even regulation worked. Like, wait a minute, you can just come in here whenever you want? Yeah, I sure can. And they're like, but you didn't call and tell us. Nope, these are not scheduled inspections. We show up. And then if they don't let us in or something like that, which happened a few times, we have to write them a ticket. It's like a criminal ticket for like $2,000. Yeah. So, it was a lot. It was a learning curve for a lot of the industry, just not knowing that like, oh, wait, we're regulated by the government. Like they get to come in whenever they want. And that's the way, the FDA functions. That's the way OSHA functions. They don't schedule those kinds of things because they want to actually see what's going on in the facility. So, there was a lot of people that, would shut the door on me, not let me in. I used to walk into places and every person would just drop whatever they're doing and walk out the back door. And I'd be like, guys, it's okay. Like, I'm just here for a routine inspection. It's okay, but they were just so terrified of what could happen, that they just would run away from me. And so, and then, there was a lot of, back in the day, there still are, I think, but I just don't know where they are, but illegal grows still existed. So they were like commercial grows in the same building as licensed commercial grows, but were actually not legal. And I have definitely stumbled into my fair share of those and been like, everyone here has a gun on them. I'm pretty sure I'm not supposed to be here. And then like jet out of there as fast as possible. So there's like really sketchy situations that we've had to deal with, but you get used to it in a weird way. And then you also get used to speaking to the level of people who have never heard anything about food safety before. I think it was Einstein that said, you don't understand something until you can explain it to a 6-year-old. And I feel like I have a very good understanding of what I do now, because the industry was a bunch of 6-year-olds for a little while there. Now they've come a long way, especially our clients. They can speak to everything that I can speak to because we trained them very, very well. But if you've never heard about this stuff and don't know anything about regulations, I mean, you don't know what you don't know. And that's just a fact. Yeah.
I would welcome regulators into my facility. I'd be like, please checkbox everything I'm doing wrong, because I'm going to learn quicker and we're going to grow a lot faster and be more efficient by following these regulations. They weren't put in place for no reason. They're there for a reason, and just follow them. But like you said, you don't know what you don't know. So is during the regulation phase when you were going into these facilities and people would scramble? Was that when you earned the nickname, the weed whacker?
Yes, unfortunately. And believe it or not, most companies welcomed us in. I think they were just so excited that they were legal and could do this for a living in the real world. Most places, was like, oh my gosh, come in, see our places. The ones that would run out the back were like the worst case scenarios and usually hiding something pretty big. But I would say 90% were in Denver, at least. That was my jurisdiction. I would say 90% were actually pretty stoked. And they really did want to learn. And then, what you're talking about, we call that a Friday night or a Friday inspection. Like the people that are going to be really easy and really nice and are not going to yell at you or like run from you or do anything weird. You save those for Friday, because if you have a bad Friday, it like messes up your whole weekend.
So was it more of a, when they gave you the nickname, the weed whacker, it's funny, but like, it's serious too. Was it more of a joke situation, or were they being serious?
I'm pretty sure the company that gave me that nickname was pretty serious. So the reason I even started doing this, because being a regular regulator where you just go in and you're following, what is already written, and they can understand those regulations. The issue is in the beginning, we wrote those regulations poorly, and we didn't know anything enough about cannabis to be writing regulations, to like just be honest, right?
Fair.
We didn't know enough. So really that was the pesticide investigations. When those started happening, that was when I was the marijuana specialist for DDPHE. I had taken on that job role. I was running that whole side of it, or helping with it as much as I could. And we didn't think about pesticides at all, contamination at all. And so we were finding concentrates that were like 56% myclobutanol, which is a very, very harsh, it's Eagle 20. It's a carcinogenic poison that people were like dabbing and breathing into their lungs. So we had to take that stuff off the market as fast as possible, because we had kind of screwed up. We had not thought about this and didn't know what chemicals they were using, didn't even think that through the extraction process, instead of getting rid of these chemicals, they actually concentrated in really high levels. So it was kind of a scramble for us when we realized this. So we had to go out, do a bunch of testing. We got a bunch of complaints, people getting sick. I mean, it was just like insanity, and we were like scrambling. So I had to go into a lot of different places and dispose of a whole lot of product. And I mean millions and millions of dollars worth of product. It put a whole lot of companies out of business. Because, when you're a small business and you have to throw away, $2.4 million worth of product in one day, that's not something you can recover from easily. And it was a really harsh time in my life. I'm not going to lie, because I really did at this point, like, love what I did. And then all of a sudden they were like, okay, now you have to be like the hammer enforcer, and you have to go out and you have to dispose of all of this product, put everything on hold. I mean, operators were crying. I mean, people were screaming at me constantly. I had to go to court a whole lot. It was super, super rough. It was for about 2 years that those were going on. And, there are still pesticide
Mm-hmm.
recalls and mold recalls to this day. It happens in any industry that you're making
Right.
consumables. It's going to happen. But for that 2-year period of time of my life, it was all that I did was that.
Oh,
And
wow.
it was really rough. So that's how I got the name, was because I just disposed of so much stuff.
But
That, I mean,
that
we just show up with a chipper and just thousands of plants. I mean, it was just insane. Like, I think
thousand
about
of
it and I still have nightmares about it, to tell you the truth.
I'm sure, disposing of thousands of plants that many consider medicine, but those who consider it medicine really don't have the ability to ingest these pesticides. They're weakened
Right.
immune systems. And that's just, it's a huge concern for me. And, standardization in the industry overall, I think, is evolving from Colorado. Unfortunately, someone has to come first with that being that test run and seeing who the perfect model is. And Colorado has been ahead of it. And I think a lot of states are starting to follow suit with what Colorado has done, which is smart. So I anticipate the newer states coming on board, was it 16 states possibly?
Mm-hmm.
I anticipate them to, be following that higher standard of what should be in cannabis, before the process, in the final process as well. So you went through all the regulations and you saw the need and you decided you wanted to be a consultant. Is that right when you became a consultant, or you founded your consulting firm?
So, yeah. So after, obviously weed whacker years happened and things kind of, started to calm down a bit, because after a while, we had cleaned it up a little bit and people learned, oh my gosh, we
Mhm.
can't use these pesticides and, and that kind of thing. And so, for the most part, just like you said, many other states looked to us and then implemented the exact same thing in other states, thankfully. Especially when it came to, mycotoxins and heavy metals and those kinds of things as well, because we ran into all those issues too.
Right.
It was like one thing after another that we were like, why didn't we think about this? And it
So
was just,
probably impossible.
it was hard. But we figured it out to a degree. And I think that a lot of other states got to learn from that. And so once things started to kind of calm down, I think we had a group of 5, like, cannabis regulators that was pretty much all they did, or some of them maybe did half and half. So we had a little like cannabis team on the health department. And it was awesome. And we had our own manager manager that managed all of us as well. So we needed the manpower because it was
Mhm.
that much was going on. And yeah, I went to the ethics board. I went to my director of the department and just kind of was like, listen, this is what I want to do. I know it sounds crazy, but I don't, I was getting job offers from big companies in the industry because
Makes
they got to
sense.
know me really well for one reason or another, sometimes good, sometimes bad. And, they were like, hey, we'll pay you this much. And I was like, whoa, whoa, whoa. Like, I know everybody's dirty, dark secrets. I know everybody's processes. I've reviewed every single SOP in this city. Like, wouldn't it be a little weird for me to just work for one company? I feel like ethically there's something wrong with that, and I don't think that regulators should be able to go and just like work for someone in the industry and divulge all of their, competition's background and what's going on in their facility, because it happens
Yeah.
every once in a while. So, so I went and did it the most ethical way that I could see fit, which was becoming a consultant and offering my services to everybody. And then I went and also signed an NDA. So I'm not allowed to really talk about, I can tell stories, but I can't tell you who the story is about, which is a good thing. You shouldn't be able to just like, talk crap
Fair.
about companies and, it's
Absolutely.
just like not cool. And also a lot of companies that didn't do very good back then are like crushing it now and like have gotten their world together and, are just really great companies. So I would never want to hurt anybody's reputation just based on my regulator lens. So that's what I did. Signed an NDA, did the whole ethics thing, and went out on my own. And I literally just like started offering me like, hey, I can come in and do these audits for you. I can, write all your SOPs and documentation. I can help you get these certifications. And at the time, a lot of certifications weren't available. GMP wasn't available. I
Right.
mean, it was like early on. And now within the last 2 years, there's all kinds of great like certifications that are available that we help people get, as I listed. And yeah, it's just kind of evolved. And, I got pretty busy within the first year, thankfully. I mean, I have no complaints, but I was so busy I couldn't handle it all. So I started hiring people. And of course, the people that I used to work with were like, hey, like, I want to work for you. And I said, okay. So now we have an entire team of 5. The consultants, we have 1 sales rep, which is awesome. He's amazing. Our other consultants are all ex-cannabis regulators. So and in fact, one of them used to be my boss.
Great.
So
the city didn't have any issues with you. I don't want to say them leaving the city to come work with you.
Yeah, well, I didn't poach them. I didn't go to them and be like, hey, you should work for me. I just posted job offers on LinkedIn. And that's how I do everything, because I do a lot of stuff on LinkedIn. And, we always get several applications, many of which, wouldn't be a good fit just because their background didn't quite align with what we needed.
Right.
And it's not that I would only hire ex-regulators. We actually really want to hire from industry really bad. But it just keeps happening where if you have already worked with someone and you already have a background with them and know what their work ethic is and know about them and know about their lives, it's a lot easier to bring them into the fold. And I think that early on in a business, the first people that you hire are going to really, teach and train the next generation of hirees that come into the company. And so I felt like if I had a good foundation in that, we would be more successful long-term, if that makes sense. So
Absolutely.
I swear I didn't poach them. They came to me, thankfully, but, it
willingly.
just happens. Yeah.
Do you anticipate a lot of other regulators from food and beverage, alcohol, also, listening to a podcast like this and saying, maybe it is time for me to make that leap and have a career in cannabis? Do you anticipate that?
Yeah. I mean, I don't see why not. But I think the problem, at least that I found, is a lot of, certified professionals of food safety, certified quality auditors, like myself and like my team, they work for the government. That is like where they feel comfortable. It's steady. It's safe. Cannabis, for most people, when I left and I said, I'm going to start a cannabis company, everyone was like, you're totally insane. That is not going to last. You're not going to make it, whatever it was. It's cannabis. It's a drug, like they got all like uptight about it. It was like, it's a legal substance that people no, they need this just as much as everyone else. And so, now we are getting a little bit of competition, but it's mostly people that have no background in cannabis at all, that aren't really a part of the culture at all.
And the consultants that I was talking about.
Right. Yeah. That, they might talk a big game, but when it comes down to brass tacks, they really don't know what's going on. And I can't even tell you how many times we've had to come in after they hired someone else. And then we had to kind of help them out and clean up after that last consultant. So I know what you're talking about. And especially in the beginning, we saw a lot of those like snake oil salesmen that were just taking advantage of people left and right. And it was really sad to see, but I feel the shift. I think that there are a lot more professionals in the cannabis industry than there used to be. A lot more people are aware of those scam types. I mean, the cannabis people are not dumb. They figure it out very quickly. And, if you're not in line with their vision and what the industry is about, and you're not a part of that community, you're not going to do well. And so, I hope that more professionals from, different realms come in, but I hope that they stay true to the culture of cannabis. And I hope that, I don't know, I hope they don't talk down or get really weird. You know how it goes. You just never know.
Absolutely.
Yeah.
That's consultants, I think the term consultant, when the industry was emerging, I'd say maybe 4 years ago, I think a lot of people have a wide range of skill sets and they don't necessarily know where they fit in with a company. They just know they've developed all these skill sets, whether it have been working in the legacy market or, as the market was emerging, they're not really sure where they fit in. So consultant seems like a broad term to use, and you're 100% correct. It is definitely going down. I hope that more consultants with your background come on board, because to me is synergy between the government and the regulators and in the industry together. And that is such a hard gap to bridge, or hard bridge to gap.
Yeah.
I said that backwards.
No,
it's very hard to bring the two.
Work with regulators. So, people get so nervous around regulators, and we don't, because we used to be regulators. So we're really good at deciphering what they're saying, talking to them on the level of like professionalism that they're used to. And we kind of are a buffer between those owners or managers and those regulators, which I think is something that most consultancies can't really do or can't really give, which is kind of one of our strengths. The other thing that I would recommend to anyone looking for a consultant is, if you ask a consultant what they do and they say they do everything, that's probably a red flag, because we certainly don't do everything.
Yeah, for sure.
We do what we do really, really, really well. And we also partner with a whole lot of other ancillary companies and consultants that do all the things that we can't do. So I think a lot of power is in the network as well. Just knowing everyone in the industry and being like, hey, if we can't do it, we know somebody that can. So, and we can send them, where they need to be.
Connecting those dots with the right people as well is a challenge too, because you're trusting that one person to connect you with someone if they don't have those resources. So tell me about Allay's. I may have pronounced it wrong.
You're
Go
okay.
ahead. Allay, thank you. Tell me about Allay's latest achievements. I know what they are and where you guys are going. It's a new market, and I'd love to explore. What are your thoughts? Share with us first what that achievement is.
We obviously started in Denver, Colorado, but we work in all 50 states. We started in Oregon, where I'm at right now, the Oregon office. It's really just my house right now because of COVID. And
I see the wind in the background.
Yeah. Oregon right now, it's green here. And so we started that in December of last year, so 2020. So I came out here, and then psilocybin became legalized, and we were really ramping up for this. We've been planning on doing this for years. So we did open a new division. So we will be doing the same things that we've been doing with cannabis. The GAP certifications, and making sure, that your products are safe, and food safety evaluations and HACCP plans and all the certifications, which we do have certification bodies that are working with us in the psilocybin realm that we've already talked them into it. Because it took a while with cannabis. We had to really strong arm them for a while.
But psilocybin was easier?
Yeah, because they were already working with us in cannabis.
Okay. I gotcha.
They were like, well, if we're going to do it, we might as well just go all in. And so we opened the psilocybin division on the 1st of this year, which was really exciting. In Oregon, there's a lot of places that are doing their own thing. So we will work in all of those states. But in Oregon, they are putting together the group to write the regulations right now. I think they got over like 500 applications for a 15-person segment. So I'm not sure if I'll make it on that board, but I definitely tried. So we'll see what happens with that. And then once they have regulations, they'll be granting licenses in December 2022. So we're already geared up. It is a little ways out, but we're going to be studying those regulations. We already understand GAP. We understand ISO, GMP, all of that stuff already. And we're just going to apply it to this industry, just the same as we did with cannabis. And so, we'll just see how it goes. We've already gotten a lot of outreach. I mean, the psilocybin community is absolutely incredible. They're really tight-knit. They're really, really into all holistic remedies, if you will. And so, I think it's going to be a very cool space to be in. And I think that because of all the medicinal benefits that they've found already, I mean, this could revolutionize our entire pharmaceutical system. Who knows? Between
watch out, regulators.
It's going to be really amazing. So we're just super excited about it.
Do you anticipate it being a full, when the market's coming together for psilocybin, it being microdose? My opinion, I'm afraid. I can't imagine someone going into a store and saying, I'll take an ounce of psilocybin and not really knowing much about it, and coming home and taking, just not understanding it fully, and understanding the conscious mind and how it affects, what you're thinking actually comes comes, I don't want to say real life, it comes about while you're under the influence. And without knowing those things ahead of time, I think it can be traumatic for some people. So do you anticipate maybe a microdose, or just going in maybe like cannabis and figuring it out as it goes?
The way that they've written the regulations is for therapeutic use. So right now, this is not something you will be able to go buy at a dispensary. So you will need it's in a prescription, but it's not necessarily called a prescription. I don't know what they're going to call it yet, but a therapist can say, okay, like, I'm licensed to do psilocybin therapy. I recommend that you take, 2 grams of this while under my supervision to make sure that I can walk you through this without. Yeah. So that's the beginning of it. I know. So that's the beginning of it. And I think that eventually how it's going to go, and this is just my own personal opinion, is, they're going to see if the sky falls with therapeutic. I don't think it will. I think it's going to be a great thing for society. And I think that we're not going to have a lot of problems with it, honestly, because if you have someone who's trained to deal with someone who is, out of their mind a little bit and maybe dealing with some trauma issues or whatever, they're going to walk them through it and they're going to be fine. Because this is not heroin. You cannot overdose on this. You will not die. And especially when you have someone there watching you who's a responsible professional, you're going to be fine. And so, that's the way it's going. I truly do believe that eventually you will be able to get microdose amounts from a dispensary of some sort. I do believe, because there's a lot of people that need that ego kill, big dose with someone that will walk them through it. I mean, people have been doing this for generations with shaman and all kinds of things. Like, sometimes you need someone to hold your hand. But microdosing it, where it doesn't mess you up, you barely even notice that it's being done to you, has been proven, to take care of PTSD issues and depression issues and things like that. So I do think that eventually they're going to have like you can come in and do the big trip with us and deal with some stuff right now. And then we're also going to prescribe you an at-home dose that you'll take. That's a very small amount that will not affect your daily function. And I think that that's the next step that we go, and that will be considered more of the medical side. And then there might be a recreational level after that. I think we just need to see how it goes and how that's going to work, because I'm pretty sure they're going to have to register and say, this is what I'm getting. This is where I'm taking it. Like, you can't just walk down the street and take stuff. I don't think they'll allow that. Not that they technically allow that with cannabis, but I think you're going to notice if somebody's on mushrooms, maybe, walking around. So maybe not. There's a lot of people that use it regularly. They could probably handle their stuff, but
absolutely.
But so we'll see what happens. I think it's going to go in phases. This is the first phase, and they're just going to see how it goes. Because if it works therapeutically, that's great, and they're going to get some really good data from it, and help a lot of people.
Well, that's a great expansion to your firm, and I think that's sounds like you're just going to keep growing and growing from here. Are you currently looking for more consultants at this time?
So my last hire was in the middle of COVID, which was a real roll of the dice, to say the least. I wasn't sure if it was going to work very well, but it did. I mean, she's great and it's great. But right now we actually aren't hiring at this very moment. But it kind of depends, sometimes we get, COVID is weird right now for everybody. So everyone's being a little conservative about spending money and hiring people. At least I am. But after this stuff kind of goes away, then we might be looking into hiring more consultants. And, especially out in the Oregon area, because right now it's just me. And, I can go in and do audits. I've been doing them forever, but I also am running a company. So it's very easy for me to be like, my consultants should be doing this. I need to be doing everything else, and running the whole company. So I think that the next place that we do hire is going to be in that Oregon area, up in the Portland area.
So for those who are looking to come into the cannabis industry, what would be some advice you would give them?
Oh my gosh. Do it. Definitely do it. Do not be freaked out by your family and friends telling you that it's a drug and that it's terrible if they are. But yeah, a lot of people thought I was crazy, but this is by far the best industry I've ever worked in ever. And I absolutely love it. And I love the people, and I just love, it's so fulfilling when you walk into a facility and they have no idea what's going on. And they're just like, they're in that infant stage. And then after being with them for a year or two, it's like they're like the number one badasses of the cannabis industry because they just like have learned so much and grown so much. We've had companies that we started with 5 people and now they're in 14 different states. We've been, with companies that were literally should have been shut down by the FDA if the FDA was involved. And then we took them to being like, they have GMP certification and they're working on their ISO 22000 so that they can sell in international markets. Mm-hmm. That's the kind of thing that we look for in a client. And thankfully we can be very picky about what clients we take on. But we really want to work with clients that are good people,
mm-hmm.
first and foremost, good people, good for the industry, and really do have that long-term vision. They want to be around when it becomes federally legalized. And not only do they want to be around, but like I said, when international markets open up, they want to be on that bandwagon. And it's a hard thing to do. Getting all those certifications is not an easy task, but we have it down to a science. So we come in and we help them get there, and we train all their staff. And it's like, from being a regulator to this is like so fulfilling and just like so amazing. And I love what we do.
I have yet to have an interview where someone said they didn't like their career.
Yeah.
They do give some matter of fact information about, some realities of getting into the cannabis industry, which is definitely needed, because I think I've heard so many people, even interviewed people who were like, I can't wait to just smoke weed all day. And I'm like, that's definitely not what we do.
Definitely not.
Definitely not what we do. It's the opposite of what we do. And so hearing people there, and then, the executives that are wanting to get into the industry are hearing that as well. And they're like, do I really want to work with people who just think they're going to smoke weed all day? And so still a balancing act for sure. Let's see, what else? I had another question for you. How can you be reached? What's the best way to reach you and your firm?
Yeah, you guys can go to my our website, www.allayconsulting.com, and check us out. We just added all the new psilocybin page and everything, and it looks all like snazzy. I love it. And then if you want to reach out directly to me, my email is Kim, KIM, _stuck, STUCK @allayconsulting.com.
My thanks again to Kim Stuck for being my guest on today's episode. You can follow our series Careers in Cannabis, as well as more great shows like this one, at TRICHOMES.com. If you're a member of the cannabis community and you have a story you want to share with us, please reach out. You can reach the show by emailing careersincannabis@trichomes.com. Please take a second to subscribe to the podcast and write a review. It really helps others to find the show. You can also join in the discussion with industry insiders by visiting trichomes.com and following us on all social media. For trichomes.com, I'm Ashley Manning. Thank you for listening, and be well.